I've just got your results back and it does confirm you're 5 weeks pregnant.
Pregnant? I can't be pregnant. I can't have a baby. I'm at uni. I can't afford to have a baby. Can I take the abortion pill?
Well, since you are at an early stage in your pregnancy, that is an option if you feel that the pregnancy would be detrimental to your well-being. I advise you to first think about it carefully, read up on available information, and talk it through with your family.
One-third of women will have an abortion at some stage in their life, and it is one of the most common types of surgery conducted in Australia. In the past, surgical in-clinic abortions have been the go-to procedure to terminate most pregnancies. However, due to its invasive nature, increased risk of side effects and complications, the surgical approach is rapidly being superseded by medical abortions pills. Abortion pills are a non-surgical alternative to induce abortion in the early stages of pregnancy, usually up to 12 weeks. Common abortion pills include mifepristone and the prostaglandins dinoprostone and misoprostol. It can be used on their own or in conjunction with each other depending on the patient. The combination of mifepristone and misoprostol are the most commonly used methods to induce an abortion. A 200 mg dose of mifepristone can be supplied to you by your doctor, which you will then need to take in their presence. The mifepristone can cause an abortion by blocking the progesterone receptors in the uterus. Without this hormone, a pregnancy cannot be maintained. It can cause decidual necrosis, which is placental detachment, and increasing the uterine contractions and prostaglandin release. It also enhance uterine sensitivity to the administered prostaglandin. 2 days later, you will be required to take 2 tablets containing 200 mg of misoprostol. However, in 6.3% of cases, an abortion can be completed by taking mifepristone alone. If you think this has occurred, please contact your doctor immediately. Misoprostol is a prostaglandin and will interact with the myometrial cell receptors to cause strong myometrial cell contractions, leading to an expulsion of the embryonic or fetal tissue. It will also cause cervical softening and dilation. Another prostaglandin, dinoprostol, can be used to expel the fetal tissue. However, this is rarely used for this purpose and is usually taken to induce labour in the later stages of pregnancy.
Whilst abortion pills are an effective treatment, there are side effects which come along with it. These side effects include nausea, dizziness, heavy bleeding, cramping, headaches, and in some cases diarrhea. However, in some circumstances, severe symptoms do occur. These include severe allergic reaction, severe dizziness, unwanted weaknesses, fainting, or even fever. In these circumstances, it is imperative to seek medical attention. In Australia, there are rules and regulations in regards to abortion. These rules vary from state to state, depending on the progress of the pregnancy. For instance, in Queensland and New South Wales, abortion is considered a crime. Therefore, you are not allowed to have an abortion unless a doctor feels that the pregnancy is doing more harm to a woman than good. In comparison, in South Australia, abortions are allowed, given that 2 doctors can consent, saying that the pregnancy is endangering a woman's life. However, in places such as Western Australia, Northern Territory, Tasmania, and Victoria, abortions are allowed until a specific period of time. For instance, in Northern Territory, abortions are allowed for the first 14 weeks of pregnancy, and in some cases 23 for emergency. In comparison, Victoria allows pregnancy for the first 24 weeks, whereas in Western Australia, it is allowed for the first 20 weeks. However, there are restrictions which occur for those that are under the age of 16. The only state which actually allow abortion is the ACT, as long as you have a medical certificate. This means upon the prescription of misoprostol and mifepristone, doctors must comply with the rules and regulations of each state, as well as take into account that these drugs can only be administered within the first 63 days of a woman's pregnancy. Furthermore, only doctors that have completed an online training course can prescribe these 2 drugs. Within Australia, Dinoprostone is also allowed to be used, however, only as a labour-inducing drug.
So have you made a decision?
I have. I've just been really, really stressed about this pregnancy. I don't think I can go through with it.
Okay, well, come back tomorrow then and I'll have the paperwork sorted out.